Okay, it looks like our numbers are slowing down just a tad. Good afternoon, everyone. I'm so happy you're here. My name is Renee Marquez. I am the Assistant Director for Student Transitions and Customer Service, and we are in our second coffee chat of the season. Today, we're going to be discussing pre-health advising. Our goal today is really just to help you as parents and supporters um, understand the process, the support, the flexibility built into pre-advising just so that students don't feel like they have to have everything figured out on day one. So, before I get started, I would like to go over some housekeeping updates. So, just to let you know, you are all logged into a Zoom webinar format. Your audio and visual are turned off. Your chat box is also turned off. However, we can share links with you should that information be needed throughout the session. We'll send out those links. To ask any questions of us, you can grab your mouse, hover at the bottom of the screen, open the Q&A, and you can ask any questions that you have throughout our presentation. Our session will be recorded and put on our website, futurefamily@arizona.edu. Should you need to watch it again, our recording will be there. I want to give a huge shout out to our colleagues behind the scenes. They will be assisting us with answering questions here in the Q&A. I'm just excited to introduce you to Chester White. He is the Associate Director for Professions Advising at the A Center. Chester, I appreciate you taking the time today to join us and really share your expertise with our incoming families.
You. Likewise, I am thrilled to be in front of all of you. I love getting to chat with parents and students before they arrive and make sure they really know about pre-health and how it all works. So I'm looking forward to going through some information with you today.
Thank you, Chester. To get us started, many of our families today are joining us whose students have expressed an interest in going into the healthcare field. And that can really mean a lot of different things. There's medicine, physicians, physicians' assistants. So, for starters, we often hear the term pre-health for students. And so, just to start today's conversation, what does that actually mean when a student is pre-health?
Wonderful. Let's dive right into this first slide then. This sounds great. So pre-health is not a major. What it is it's really focusing on any sort of medical, dental, or graduate level health program. So this is typically means after a student has earned their bachelor's degree, they plan to pursue a graduate level health program or obviously medical dental. Um, so this, like many of the health careers you mentioned, physician's assistants, physical therapy, occupational therapy, yeah, the list kind of goes on and on. Um, so that's what we're talking about. And I think what's great about where we are at the university is that pre-health advising is a little bit different than the advisors that most students will get that are assigned to them. Every student has to declare a major. Um, and there is not a pre-health major. So what that means is that a student will have to choose their major and they will work with a major advisor who will make sure that they actually earn a bachelor's degree because pretty much all the health professions are going to require a bachelor's degree. So maybe if there's somebody here that has a student that's wanting to be a chiropractor, they may not have to have a bachelor's degree. But most of the health programs we're talking about, they will need their bachelor's degree. And so their major advisor will serve as that resource to make sure that they can graduate on time and complete all their degree requirements. What pre-health advising does is it's going to strategically work with the student to say, there's a lot you need to accomplish while you are an undergraduate so that you are competitive for the application process that you will begin later towards the end of their undergraduate career. And so that's really what we get to do, and we're always excited. Something unique about us is that we work directly with medical schools and the graduate professional schools, along with all of the organizations too, as far as that really are where the applications are submitted. So we get to stay up on all of the trends and the way the application cycle will go for a lot of these health professions. So that's really what makes us the kind of those experts. The other thing that's kind of fun about pre-health advising, because it's not at every university, and U of A takes pride in having it, is that it's also a chance for us to really be loyal to students. Like, I love to talk about it because like I'm working with students who are going to be applying to medical schools all over the country. Now, yes, they might really be interested in College of Medicine Tucson, and obviously we work very closely with them, but we also work closely with all the other medical schools. So that's what's kind of exciting is that we are in a unique position, unlike a major advisor that's just making sure that you complete your degree. We're working with individual students to try to figure out what's going to make you more competitive. Let's look holistically at everything you've done. What major are you in? How are your grades? How are you preparing for the MCAT? Are you on track? All of those sort of things that we can kind of check in at key checkpoints to really make sure that you're on the right progress towards your what you're wanting to do. So that's kind of what pre-health advising is. So I just want to make sure it's really different than major advising, and that it's not just pre-med advising. We work with lots of different health professions that students might be interested in. I have to put in a plug too. We are actually housed in the A Center, so the colleagues that we work with also are the major exploration advisors on campus. So students that either have decided that's not the major they want to pursue and they're going to explore other options, or they come in completely no major selected. Those are our colleagues, and I love that we get to work with them on a daily basis because in our jobs, we often are helping students explore different health professions as well. Sometimes students come in with a very preconceived notion of what a physician is, or what a physician assistant is, or what a nurse is or whatever they realize that's not at all what I want to be doing. And so helping them explore other health professions is kind of a fun and necessary part of the process. To be a competitive applicant, students really need to be reflective and understand like how is the health profession that they're wanting to pursue, how is that different than the other health professions that exist. So yeah, so that's a little bit about pre-health advising and the A Center. So
Thank you for sharing. You said a couple of things in there that I just want to touch on really quickly. There's also a good question in the chat from Jordan. So you mentioned that pre-health advising is not a major, whereas nursing is a major. So the question is, since nursing is a major, is it included in the pre-health realm?
great question. Nursing's a complicated one. It's very, because U of A's nursing program is very competitive, and it's a bachelor's degree. And so most of the programs that we work with are not bachelor's degrees. They really are graduate level or medical, like they're beyond your bachelor's degree. So what I would say to that is if any students that hopefully you've been accepted to the nursing program, but if you are still hoping that you're going to be accepted in the nursing program, we would pretty quickly direct students to talk to the College of Nursing for that situation. However, keep in mind under health professions, we can talk to students about alternative pathways to nursing. There are so many ways students can become nurses that is not just the BSN in nursing, which again, we won't advise. That's a major. We don't advise for majors, so we're not going to advise that specific degree. But students that are like, I didn't get in to the nursing program, but I still want to become a nurse. What are my options? We are happy to talk with them about what that might be. And that may mean even not options at the U of A. But we'll try to exhaust all the options with that student so that way they can make an informed decision about how to move forward.
Um, so you talked about some of the majors. It feels like nursing is so popular. Chester, can you mention maybe some of the various majors that are involved with pre-health?
Yes. So this is great. And actually I think this relates to the next slide. So we'll switch slides here. Because I often get this question. We pre-health advisors always get this, and we especially from students and probably more so from parents that are coming in and saying, my son is pre-medicine. That's his major, and he's going to get into this medical school. And I'm like, hold up, let's slow down. So, what I would tell you is for all the different health professions, what is the best major? It's going to depend on the student. So, there is not a one answer that fits all. Um, for health professions, and I'm putting nursing on the side because that is a bachelor's degree, right? All the other programs I'm talking about are graduate level. It's going to depend on what's going to make the student the most competitive. And often that comes down to several things. Is it a good fit for the student? Meaning, are they like authentically interested in the subject area that they'll be studying? Do they get excited about what they're going to be studying? In the end, the medical schools or the graduate health programs are going to be looking for students that have developed intellectual curiosity in that major that they chose. What I often will tell students that come in selecting the typical major just because they're like, well, I'm just assuming that's what medical schools are looking for. And I'm like, well, let's fast forward to your medical school interview. And the question that comes up is, tell us why you chose your major. They're going to be looking for intellectual curiosity in that answer. And so if you said, well, my advisor told me to do it, or it just seemed like it was the best fit for the major, that's not going to go well for the medical school. So I want students to really, this is why I love talking to parents early because we want to really push the students to be as competitive as possible. And what that often means is they have self-reflected on what major they should really be pursuing and what they'll be passionate about. In pre-health, we're going to advise you on the common prerequisites that medical school or your graduate program is going to be expecting. So you're going to have to complete those courses regardless. But do you really need to take all the other courses along with that major? So, for example, I know you're asking like what majors. Very commonly, we see students will choose BS in medicine, they'll choose physiology, biological sciences. The list can go on and on and on. And what I would say is that yes, some of those majors have a lot of the prerequisites built into their major, but does the student get excited about all those courses? Like all of them? Like they're going to have to take the required ones, but do they need to take all those other ones? The example that I just like to use is because I think I ran into this with a student and I loved it because it was a student that had already developed intellectual curiosity as a first year student, where they came in and they were religious studies, but they were pre-med. And it was fascinating to me because they already could answer that interview question. They said, I'm pursuing religious studies because when I'm a doctor, I really want to be able to speak to the patients. I want to understand their religious beliefs, how that's going to affect the decisions that they make about their health. But also, this particular applicant was also thinking about they may, if they are going in oncology or if they're going to be working with cancer patients, they might have to deal with death and dying. And how do they have these conversations about patients and how they see death and how they see, the end of life? And so for me, that was fascinating because they're getting the humanistic side of something that's really related to the medical sciences, but they're also going to obviously take all the prerequisites for medical school to get themselves in. So that's where I say that was exciting for me, and I think that's really rewarding for us pre-health advisors when we see students who have really pushed themselves to study something they're really passionate about, but also take these prerequisite courses. What I also have found in my experience is students will thrive. Students will do better. And trust me, medical schools are expecting as close to a 4.0 as possible. So they should be taking the courses they're going to thrive in and also really enjoy. And so often I will use myself as an example. I was pre-veterinary medicine when I started undergrad. I started bio and chem my first year. By the second semester, I was like, I hate chemistry. Why am I doing this? Clearly that wasn't my path, right? So I've talked to another advisor and I realized like I really should be working with people and obviously found my way after that. But what I would just say is that's what we want students to do. We really want them to reflect. We don't want them to just look for the black and white answer that they think is the right answer that will make them the most competitive. That's strategy building, and that's what pre-health advising does. It helps you strategize your application that you will have in the future. Yeah.
Thank you for sharing that. That's so impressive. So you kind of answered this next question that I had for you. So if a student, let's say, starts in biology or religious studies, and they decide that that's not the path that they want to take, how does pre-health advising help them to explore other options? You kind of already touched on that.
Yeah, no, that's a great question. So, because we work with our colleagues in the ACE Center that work with major exploration, depending on how far we may need to go, we have lots of different tools that we can use with students, where we can kind of assess where that might land. Often, it's going to come down to the student's interests and what they actually are really doing well in. It also will depend if they are really set on pursuing that specific health profession. So if, depending on where they go, and again, this is what I like about it in your first semester, students really should be engaging because we want to make sure it's the right fit. And if it's not, we can quickly make an adjustment. Like we can help them try to figure out, do they need to switch their major? Do they need to do that? And switching majors can be complicated depending on what major you're trying to pursue. There are some majors that are very sequential and some that are very open, some that are very easy to switch into, others that are not. So it will depend. And I think that's why I love it when students get to work with us because we'll really kind of help them make informed decisions so that way they can really make sure this is the right fit, this is the right way to go. So did I answer the question though? I want to make sure I did that.
Absolutely. Yes, you did that very well. Thank you, Chester.
Good.
So we're talking to these new incoming families, all families who are interested in supporting their student coming in to college for the first time. I have to ask you, do students need to have everything figured out on their first year to stay competitive for these health majors?
They do not, and that's what's great. They really need to make sure that they are acclimating to the university and that they're succeeding academically. That's really the most important thing. Um, what I would say, actually, let's go to the next slide. I think that will kind of address it too. So, like, let's talk about really what should a pre-health student accomplish in their first year to assure they will be competitive for future applicants. Um, what's great about it is they do really have some flexibility in their first semester. They really should be affirming that this is what the major that feels like a right fit for them. They also, academics are going to speak loudly. Um, it's really, really important that students are successful in their courses. Um, a lot of the parents here may have students who are even doing dual enrollment courses right now. Students need to know that every course they're taking for college credit is going to be calculated into their MCAT. Like, let's say they're applying to medical school, every one of those grades is going to be calculated into the GPA to determine if they're going to admit you for medical school. So it's really important that students take grades seriously from the very beginning. Also, students don't get a lot of wiggle room. So if don't perform well and then they repeat the course, GPA calculations are still going to use the original grade along with the new grade. So I just want to make sure there's some room for figuring things out, but as far as academics, there's not. Students really need to be performing well from the very beginning. That doesn't mean that they can't have a few blemishes on their transcript and still could potentially get in, but it's going to be really important that they find the right fit and taking the right courses that they can be successful in and get using the resources. I think that that's what's key is that whatever they may not be strong in, if that's an area of growth, then they just need to make sure that they're getting the resources on campus so that they can be successful. Yeah, that's really important. I just say also, as far as what students need to really accomplish in their first year, it really is major affirmation. It's a strong GPA. They typically need to start on some of the prerequisites that we would start off with. So they're going to need to start their chemistry sequence, especially once they've completed the required math that they might need for their major or for the the health career they're wanting to pursue. That's going to be really critical. The other thing too that I would say to get them started out is they really need to be understanding the health profession that they're wanting to explore. They need to go try to shadow. So if they want to be a physical therapist, have they shadowed a physical therapist? Have they gotten into that office? Um, Same thing with any other health profession. I think that's really critical. Often, most of these programs are going to require them to do official shadowing with these health professions anyway. And I want them to really explore. I want them to be able, because they often may even get this in interview questions too, is how is a PA, a physician assistant, different than a physician? What do they do that's so different? Um, what does a PT do versus an OT? Like, what's the difference between an occupational therapist and a physical therapist? So students really need to engage in that early. I think this affirms not only that they're pursuing the right health profession, but they also kind of get to see what they do. And maybe the minute they start to get to see something that they get to do, they might be like, oh, this is not for me. I know I've ran into a lot of students where the minute they had to actually deal with blood, they were like, nope, can't do that. That's going to be a problem, right? So I think these are the things that are so critical at the beginning is just getting that exposure and really connecting. So the other thing they do is encourage them to get involved in things that they're really authentically interested in. So anything that will provide them, because medical schools are and other health professions are going to be looking for leadership. They're going to be looking for patient experiences where they've actually had to work with patients. So are there certifications that they could be working towards? Are there beyond just shadowing, is there ways for them to actually get connected to patients? Community service as well. There's a lot of things that they can start doing. A lot of times parents and students will ask, well, they did all this stuff in high school. And I'm like, that's great. Medical schools aren't looking at that. Medical schools are looking at what have you done since you started at the university. So I often tell students if you've done something or you're shadowing or you're doing something that's amazing in high school, is there a way to continue that into college? If there is, like over the summer or something like that, then you can make that a really that then you can use that on your medical school application as long as it's something that you did while you're in college. Yeah. So I'd say that's what I say focus on, but my main message is grades. Focus in on major, make sure it's a good fit, make sure your grades are going well, and that this is the right health field that you want to pursue.
Thank you, Chester. So you touched on what helps students to stay successful. You have touched on ways that families can support a student who is interested in a health career, really helping them to get involved, helping them to shadow. You covered all of that. Um, are there internships available through the University of Arizona as an undergraduate?
There absolutely are. And most pre-health students are going to need to really consider having at least one. So it's really important that students network. So I think families can often help by thinking about who do you know already. So like, for example, if they're going to come home in the summer, is there something they can arrange at their local hospital or at a local clinic that they can go ahead and maybe start with some of these experiences? But clear on campus, yes, connect with us, connect with various different clubs, student clubs and organizations as well. We have events like, for example, tomorrow we have a Health Professions Expo. We're bringing in about 60 to 70 different graduate medical programs as well as different agencies or organizations that provide clinical and volunteer experiences for students. So there's lots of ways for students to get connected, and I think those are the ways I would say families can help getting them involved is encouraging them to do that over the summer during breaks. Definitely connecting with people that they already know. On campus, if they just can't seem to find things, then please reach out to us. We can at least get them directed to some of the clubs or organizations or departments that provide some of those resources on how to get started.
So how can students prepare for this grand career? Is that something that the E-Center can help with?
Yes. So we obviously will work with lots of different resources for them to kind of explore. Um, Actually, let's go to the next slide. I think it talks, well, yeah, let's go to the next slide. I think we can use that too. Um, But yes, like there's a lot of things I think that they can be doing to kind of move towards this career. And often what it comes down to is some of the things that they should be doing outside of the classroom. So not only do they need to perform really well academically, but it's a lot of these experience these experiential moments that they need to have. I like to use this as just an example, and this is not black and white answer. It's kind of the recommendations that we're kind of putting together in our office. This is a typical, so let's just say a typical medical student applicant. This is typically what we'd recommend that they, at minimum, they kind of be at. So, like for community service, do they have at least three that have been 6 months to a year before they graduate? So that way, because the medical schools are often going to be looking like, are you committed to community service? And how so? And again, I'd say authentically, can you get involved with something that you authentically would enjoy that's community service related? Patient experience. So this would be often where they're working on certifications. Maybe they're doing a phlebotomy. They're working as a phlebotomist for a little while over the summer. There's lots of different ways to get patient experience, but that's going to be really critical too. Most medical schools are going to expect that they've had direct patient experience in order to move forward. Physician shadowing, again, often it's hard to get connected to multiple physicians, but that's really important that they have been able to shadow different physicians in different settings so that way they have that exposure. Also, depending on the medical schools, a lot of medical schools will hope that they've done some research while they were in undergrad. So if it's typically, is there a research project that they could be thinking about even from their first year about how to get connected with a faculty member or on a research team to move forward before they graduate? And then leadership, that's often with student clubs or organizations or outside agencies where students have gotten connected. So I really like to just show like, these are the things that students will need to do by the time they get to their application. And we just like to kind of introduce this stuff early on so that way students can be thinking about how do you fit all of this in while also performing really well academically and excelling in your academics.
That's helpful. Thank you for sharing that. So we are getting a lot of questions about the nursing program here in the chat. Um, so if a student, Chester, can you help me with this question? If
Sure,
a
let's do
student
it.
didn't get into the nursing program, do you know, are they able to apply at a later date?
So, nursing, I think, as most people probably know, nursing has, and I can't speak directly for them because I'm not College of Nursing, but we work really closely with them and we enjoy their partnership. It is a very competitive program. They have been moving over the last couple of years to being where they are admitting the high school students directly in, it's direct admissions into nursing. And they are not typically allowing a lot of students that have gotten to, that are now at U of A, but have not been accepted into nursing. I'm not going to say they're not going to do that. I know last year they were still taking, if they don't meet the numbers, then they typically might also accept students into the program. But they often are looking for, have you met the prerequisites? Also, have you met the requirements? Like, is your GPA where they currently are wanting GPAs to be at? So they may require you to have a semester, if you're not admitted as a high school student, they may require a semester at U of A where you can get the GPA that you need, but also have you met all the prerequisites. So often I refer students back to their website to say, look at their admissions criteria, make sure that you've met that, then make sure you're meeting with them. Also, just understand your U of A's nursing program is very competitive. They take pride in being very competitive, but that is just one way to become a nurse, right? There are so many other ways to become a nurse, and that's what our office can help you with is kind of decide what might be those other options that you might want to consider if U of A's nursing program is not going to work out because you are not able to get admitted.
So, Chester, you have an incredible team behind you that specialize in advising students. And I might throw you for a curveball here, but I wanted to know how often, is there like a general, how often students should come visit the A Center to keep on track? So they're looking to visit their advisor. Is visiting the A Center, is that something separate they should have on a schedule, or is that really when just to make sure that they're keeping on track with things?
This question. Let's go to the next slide because this is perfect.
Okay.
We really do often it's up to the student. So students often are pretty much like they're going to be required or think that they need to be meeting with their major advisor, right? They should be in order to graduate on time, right? And to make sure that they're taking their courses in the sequences they need to be. For us, it's kind of up to the student. We don't mandate that they meet with us, but we really do want to meet with them to make sure that they're staying on track. So I would highly encourage that, yes, once a semester, be checking in with us. I try to really stress it's most important that they meet with their major advisor first and find out what is it that's sequential for their major that they have to take and make sure that they follow their major advisor's advice in that. Come check in with us to find out where are you on all of the rest. How are you doing on your prerequisites? I'll use medicine for an example. If a student's pre-medicine and they're taking their prerequisites, we're going to be looking at that to say, let's create a timeline. When are you going to be taking the MCAT? These are all the courses that you really ideally should take prior to taking the MCAT because it's going to help you hopefully be more successful on it and should make the studying for the MCAT easier. So those are the sort of things that, yes, that's why we do want to see you regularly. We hope the students can get in at least once a year, if not every semester, just to kind of check in with their progress once they've met with their major advisor. This slide just kind of shows exactly what they could come meet with us about. There's so much to talk about in pre-health. So like the coursework, like what is all the common prerequisites for the program that they're wanting to apply to, the rigor, the timing, the timeline, all of that. But also, we're going to help in the end, like we can help with personal statements, resumes, all these pieces of the application, strategy of what letters of recommendation to make sure that they have ready when by the time that they're ready to apply, of course, how to prepare for the MCAT. And then, of course, I know the slide before this was all about the experience. Like, how are you doing on the experience that you've done so far? Like, where are you with that? But I think there's also these things that are on these other boxes that basically a lot of times students don't think about. Like, there are competencies that they're hoping students are developing in undergrad. So we like to check in with them to say, do you have examples of these? Like, so when you apply, are you going to be able to demonstrate you've developed these level of competencies? But also like that, like what medical schools are you going to apply to and why? How do you know that you would apply to ASU's new medical school versus College of Medicine Tucson? They're very different. If you look at their vision, mission, and goals and what they're looking for, they're very different. Students would want to really research that so that that way they can understand why they might want to apply to one over the other. And of course, there's a lot of different specialized programs, resources, even financial assistance, because yes, it's a huge investment to go to medical school. So just kind of thinking about long term, how do you do all of those things? It's so critical to meet with us. And yes, I know I can speak. I see my advisors' faces right now, and they're like, it's sad for us when we see a student that's basically thinking they're ready to apply, and then we have to tell them you may not be ready. You may need to consider more a gap year because there's a lot of things that you have not been able to do yet. So we can't stress enough. Yes, we want to see students. We want to see you succeed. We want to see you get into the medical school or graduate health program that you want to get into, but we just need to see you in order to make sure that you do that.
That is good advice. Kind of as we're starting to wrap up our pre-health advising coffee chat, I see a lot of our questions in the chat. Great questions from our families are starting to slow down a little bit. I do want to let you all know that we have uh, this is Chester's incredible team that he's got a slide on. I want to make sure that we highlight this. But I do want to let you all know that we have future coffee chats. You can go over to our website to register for any of those. I saw a couple of questions in the chat that was asking about study abroad. We do have a coffee chat coming up about study abroad that will also cover, medical field and all the different majors. We are going to be having Admitted Student Day for incoming students. So if you are looking to tour the University of Arizona, this is a little bit more than that. Students will be able to visit their colleges and kind of learn more about what is offered. Tons of Wildcat spirit. I will have you know that future families will have a presence in the family lounge out on the mall. It's a big tent. So if you are coming with your student to one of the dates listed here on the screen, and your student is meeting other students, they want to do this on their own, and you want to come out with us in the lounge, you're welcome to do so. We'll have couches and stuff to kind of relax, and we'll have some resources and stuff for you to check out. So come visit us over in the family lounge that will be out on we call the mall, the grassy area in the middle of campus. I do want to let you know to save the date also in the future. Come move in for students. We have these dates here for you as parents and family members. Tuesday and Wednesday is a family mixer. We invite you to come and spend some time meeting other families, checking out some resources. We will have a big resource fair in combination with Destination Arizona. And then on Friday, we will also do a family conference, a welcome from our campus leadership, along with true conference style sessions that will follow after the conference. Uh, Future Families is that host our events for all of our new incoming Wildcat families. This is how you can contact us should you have any questions. I get good questions over email almost daily, so feel free to shoot us um, a message anytime you have a question about something can help you out with that. Chester, you have been wonderful. I appreciate your time. Your team has been rapid fire answering our questions here on the back end. I can't thank you enough for your time today. Do you have any last thoughts for our families?
No, it's been a pleasure. I wish you all luck and make sure, yes, parents, families, all the student supporters out there, encourage them to come meet with their advisors, their major advisor, and us if they're wanting to pursue a health profession. We'd love to work with them.
Thank you so much. Thank you, everyone who joined us for our coffee chat today. I will hang out if there's any last minute questions just for a few more minutes. Appreciate you being here.